Klinefelter Syndrome, KS, also known as 47XXY, is a genetic condition that affects males who are born with an extra X chromosome. Typically, males have one X and one Y chromosome, 46XY, but in Klinefelter syndrome, an additional X chromosome is present, resulting in a 47XXY karyotype. This chromosomal variation can affect physical, cognitive, and reproductive development, and its severity varies widely among individuals. Causes and genetics. Klinefelter syndrome occurs due to non-disjunction during meiosis, a process in which sex chromosomes fail to separate properly. This can happen in either the father's sperm or the mother's egg, leading to a sperm or egg with an extra X chromosome. When this gamete combines with a normal gamete from the other parent, the result is a male child with an XXY chromosomal pattern. Occasionally, the syndrome can occur as a mosaic form, 46XY/47XXY, where some cells have the extra X chromosome while others do not. This mosaicism often leads to milder symptoms. Physical characteristics. The physical manifestations of Klinefelter syndrome are often subtle and may not be immediately obvious, which is why many cases remain undiagnosed until adolescence or adulthood. Common features include taller than average stature, long limbs, and a slightly broader body. Individuals may have less muscular development, reduced facial and body hair, and gynecomastia, enlarged breast tissue. Testicular development is usually underdeveloped, leading to smaller testes and often resulting in infertility due to impaired sperm production. Some males with KS may have a soft or less rigid penis, and decreased libido can also occur. Cognitive and developmental aspects. Klinefelter syndrome can also impact cognitive and social development. Language development, reading, and verbal skills may be delayed in childhood, although intelligence is often within the normal range. Many individuals with KS exhibit mild learning disabilities, difficulties with attention and executive function, and challenges with social interactions. Emotional and behavioral issues, such as low self-esteem or anxiety, may arise due to social difficulties or physical differences. Health implications. Apart from reproductive and developmental issues, Klinefelter syndrome is associated with increased risk of several medical conditions. These include metabolic syndrome, type 2 diabetes, cardiovascular diseases, osteoporosis, autoimmune disorders, and breast cancer. Hypogonadism, a condition in which the body produces insufficient testosterone, is common and can contribute to fatigue, reduced muscle mass, and decreased bone density. Early diagnosis and treatment can mitigate some of these health risks. Diagnosis. Diagnosis of Klinefelter syndrome can be challenging because symptoms are often subtle. Prenatal diagnosis is possible through amniocentesis or chorionic villus sampling, which detect chromosomal abnormalities before birth. Postnatal diagnosis is usually made through karyotyping, which analyzes a sample of blood to determine the chromosomal pattern. Hormone testing, including measurement of testosterone, luteinizing hormone, LH, and follicle-stimulating hormone, FSH, may also assist in confirming the diagnosis. Treatment and management. There is no cure for Klinefelter syndrome, but early interventions can improve quality of life and outcomes. Testosterone replacement therapy is commonly used during puberty to promote the development of secondary sexual characteristics, increase muscle mass, improve mood, and support bone health. Speech therapy, occupational therapy, and educational support can help manage learning and developmental challenges. Fertility treatment, such as testicular sperm extraction combined with assisted reproductive technologies, may allow some men with KS to father biological children. Psychological support and counseling can also be crucial for addressing emotional and social difficulties. Prognosis. With appropriate treatment and support, individuals with Klinefelter syndrome can lead healthy, productive lives. While infertility is a common challenge, many men achieve satisfactory sexual function with hormonal therapy. Lifespan is generally normal, although attention to associated health risks, such as metabolic and cardiovascular conditions, is essential. In summary, Klinefelter syndrome is a chromosomal disorder affecting males due to an extra X chromosome. It influences physical development, cognition, and reproductive function, and can lead to various health complications if untreated. Early diagnosis, hormone therapy, educational support, and medical management play a vital role in improving the overall well-being and life outcomes for affected individuals. Awareness and understanding of the syndrome help reduce stigma and promote comprehensive care.